Using the MVX blood test is like looking inside your body with a crystal ball. It measures the 5 most important subjects within your body regarding chronic illness and keeping your health up. They are infection, inflammation, toxicity, malnutrition, all leading to mitochondrial dysfunction. These are measured in 6 different ways in MVX Plus, and I'm going to show you 2 examples. One is mine and then one is a patient's. So follow along. I've done this 5 times now. This is the first one, January of 2025, right below me. The overall score was 55, and I had terrible pain in my lungs and heart from a gas leak. I'd shut this gas leak off on December 7th of 2024, and then January 13th, when I had this first test run, I still felt it. I didn't do anything different, and then 4 weeks later, over here, my score dropped to 31. You want your score to be lower, between 1 to 100, so this is a great improvement, a drop of 24 points just in 4 weeks. I didn't change my diet. I didn't change any supplements. I didn't exercise more or less. I just quit breathing in natural gas. So the toxicity of gas shows up here with what's called the small acyl particle number right below me, right there. And the score should be 19 or higher. January, it was 11.7. And then 4 weeks later, it jumped all the way up to 17.1, which is absolutely fantastic. And I felt a lot better. Now, this score here, it says inflammation vulnerability. My score was 50, and it should be in the 20s or 30s, and it dropped down to 27. This is excellent. And then the metabolic malnutrition index, that should be upper 40s, lower 50s. So initially, it was at 59, and this is a measurement of all these other factors below me here, citrate, valine, leucine, and isoleucine, which I'll talk about in a moment. But they compile metabolic malnutrition index. So for my score to drop from 59 to 47 is excellent, and it can just show you that toxicity, such as a gas leak, can harm your digestive system and utilization of nutrients. But the point is, my overall score went from 55 to 31, and my toxicity dramatically improved from 11.7 to 17.1. Now follow along with me because I'll show you the next 2 labs and I'll tell you exactly what happened. Here's my third test. So my score went up from 31 to 39. It went in the wrong direction, but why? It's because I had a sinus infection. So my glyc was down to 315. It went from 335 to 315, but it jumped up to 350 because of the sinus infection. And then my toxicity went from 17.1 to 16.1. It went down, which is bad. Bacteria can release toxins. For example, gram-negative bacteria release lipopolysaccharides, and that's very, very toxic. So I had an increase in toxicity and infection, and that's why my overall score went up. So I handled the sinus infection, and look at my score, it dropped to 29 in 4 weeks. I'm doing these tests every 4 weeks. So it went from 31 to 39 and then 29 because I got rid of that sinus infection. And notice my glyc, which is inflammation and infection, it was 350 and it went all the way down to 286, which is phenomenal. You want that to be below 300. And then the small acyl particle number, which is toxicity, it was 17.1. It got worse to 16.6. And now it went up to 17.5. You want that to be 19 or higher. So this is my 5th test right here, and I'm doing pretty good. My score is 26, and I'm taking supplements, and I'm feeling much better. And notice my glyc is still below 300, which is phenomenal. But my small acyl particle number is still 17.1. It's not at 19 or higher. So I know that I have some detoxing to do. So I started a product called SP Detox Balance. It's a big tub powder, mix it with water. It tastes really good. And I start taking it, and I know that I'm feeling worse. I'm having detox reactions. I feel better, but I feel worse at the same time, if you know what I mean. So I'm getting my old symptoms back from the gas leak that I had. And when I was going to the bathroom, my bowel movements smelled like chemicals. And it was a little bit stressful, but I was feeling better at the same time. And it's stressful because of the detox reactions. So I just kept working my way through it. And notice what happened 4 weeks later. My score got worse. My overall score went up 11 points. Now, it's not a bad thing because I know exactly why. It was from the detox reactions. Notice that my glyc, though, stays below 300. It only went from 282 to 285. That's inflammation and infection. Remember, I'm detoxing. That's what I was doing. And my small acyl particle number got worse. It went from 17.1 to 15.2. So that's not supposed to happen that way, but it did because I'm detoxing. Now, I have 3 other people who are feeling better, better sleep, better digestion, better bowel movements, better energy because they're detoxing and their MVX plus score got worse. So this is one thing I've learned since I've been using this since January. So my overall score went from 26 to 37. That's up 11 points. So the next thing I'm doing is getting test number 7 done. That's tomorrow morning as of the recording of this video. And I'll post in the comments what my next score is with a little explanation. I have not taken this SP Detox Balance product now for 5 days. And I feel better. After the blood is drawn, I'll restart SP Detox Balance and get back into detoxing because the overall goal is to get this small isotopes particle number back up to like 19, 20, 21. When people have that number up above 19, they are doing quite well. I've seen this over and over again. When people have their small isotopes particle number at 11 or 8 or 12 or 14, they're not doing as well, but they're gradiently getting better. And I just see people with higher counts, like at 20, they're doing quite well. All right, let's talk about this person. I have his permission to talk about his healthcare without saying his name, of course. And he first had his MVX test run February 3rd, but he wasn't a patient of mine until I think it was April. And his score was 60, which is quite high. And he had a stroke a couple of years ago. He had fatigue and arthritis pain. And his inflammation vulnerability index is 67. You want that in the 20s or 30s. His glyc-A, which is infection and inflammation, was 527. And his small isotopes particle number is 10.6. Again, you want that up above 19. So look at what happened 3 months later from the beginning of this test, but he was only under my care for 3 weeks. Here's what happened. His overall score dropped to 42. That's an amazing drop. So 18 points. And then his inflammation vulnerability index dropped from 67 to 34. And he was feeling a lot better. His glyc-A dropped 200 points in 3 weeks. His small isotopes particle number went up from 10.6 to 15.7. I put him on parasite supplements and I had him stop eating bread and grains. So here's his follow-up scores. I'd mentioned that test number 2, his score is 42, and then within 2 months it dropped all the way down to 34. So again, the phenomenal results. I'd mentioned he had a stroke 2 years ago. When I saw him last week, his speech was faster and louder. He seemed stronger with his voice, but he's feeling a lot better. And he said he was overall 80% better in the few months he had been with me. There's still some work to do. His glyc-A needs to be below 300. It went from 327, not too shabby, to 312. A little bit more work with that. His toxicity, which is what we're really focusing on, it went from 15.7 up to 17.2. So his score there equals mine. We both have a little bit more detoxing to go to get it up to 19, and that may take 6 months or a year. I'll give you more examples in the future about how great this test is to measure the most important factors. It's just amazing how I made this graphic back in 2016, 2017, based on the founders of medicine, and what they said is you have to address the causes of chronic illness here, and then you fix the mechanism. The most common mechanism is called lactic acidosis, and then you get rid of symptoms by feeding organs right here. If you have a chronic illness, you have to do all 3 of these circles. In medicine, they talk about symptoms, they test symptoms, and they treat symptoms. Never do they treat the mechanism, and sometimes they treat the causes. Now MVX lines up with these 3 circles like this. The small isotopes particle count measures toxicity, glyc-A measures the infections and inflammation, and then the branched chain amino acids, they measure your diet, which is excess sugar metabolism in this causes circle. And then the citrate measurement in MVX measures the mitochondrial function or lactic acidosis. I can't say it enough how much you can see inside your body and what needs to be done to improve chronic illness. And we're not measuring risk factors because those are a little bit shady. And we're not measuring pathology. That's the end result of these factors going haywire. We're actually getting to the root cause of why people get ill from any kind of chronic illness. I don't care if it's cancer, heart disease, chronic infections, autoimmune disorders, hormonal problems. These factors in MVX are pre all of that. So if you have, like, for example, a hormonal disorder, you can take hormones, and then you address the factors within MVX that cause the problem in the first place. Same thing with autoimmune diseases. You could take a steroid and then address the factors in MVX. If you have chronic fatigue, fibromyalgia, even heart disease, or the beginnings of cancer. You have to fix the causes of all that. And MVX measures the most important factors known now for 96 years. Literally, Dr. Otto Warburg, the founder of physiology, discovered vitamin B1 and its importance in respiration and metabolism, and it affects 4 parts of MVX. So we have 96 years of physiology and understanding how the body works and how to correctly address those factors to extend your life and improve your health. If you want to run MVX, you can go to my website, thenhcaa.com. Go to the upper right corner, you'll see these words MVX test right there. Click on that, and we can get the process rolling to get your MVX test. If you're a doctor and you want to learn how to run it, I have a new website coming up. It's called theholistichealthacademy.com. It's launching July 10th. It's set up like a membership site for doctors to learn, also patients. And a lot of the material in that website is how to reverse these factors of MVX. It's called the 7-Step Blueprint to Optimal Health. This website also has 1,800 meals and recipes for different diets, such as keto diet, low carb diet, Whole30 diet, and more.